The format for our panel is we wanted to take a moment and have each of the panelists just give you a little bit of a background on their organizations so that you have some perspective when they're speaking about their facilities and what they have available. So Sharp Healthcare in San Diego is a health system that has 7 hospitals. 4 of those hospitals are acute care. And then we have 3 specialty hospitals, 2 medical groups, and a health plan. We're the largest healthcare system in San Diego with over 2,000 licensed beds, 17,000 employees, 2,600 affiliated physicians. Additionally, we have a full range of other services. From a mobile engagement and patient engagement perspective, I just wanted to share some of the items here that we've been involved with. As many organizations, we do have a very robust patient portal. We've also started doing some remote monitoring with our population health initiative using CardioCom. We've been using Propeller Health for asthma management with some sensor technology on patients' asthma inhalers. We've been doing texting for diabetes reminders. We've just updated our website to be mobile friendly. And it's funny because people probably wouldn't think of a website as being a patient engagement platform, but it's really where most of our consumers first connect with us. Sharp Baby is a new app that we've just deployed for expectant mothers. We have online scheduling, bill pay. We're offering survey tools. We've recently been working with a physician practice on some cardiac implantable devices, and we're kicking off a telemedicine initiative that we are requiring be mobile ready.
So good afternoon, everyone. You guys are brave staying this long, so you're going to be in traffic, so I appreciate that. We'll all be in traffic together. I'm an alumnus here, I just want to say, so I always love coming to UCLA. So, yeah, woo! Go Bruins! There's always next year. Just real briefly, my name is Sajid Ahmed. I'm the Chief Information Innovation Officer at Martin Luther King Community Hospital. We just opened in July of last year after the old hospital was closed down in 2007. And we opened it in approximately from start to finish when we had to get everything going, just to give you kind of a sense of scale. I think we took about 12 months to put all the technology infrastructure in, hire 850 people, develop over 2,200 plus policies and procedures, test everything, go live, get licensed, get accredited, and open a very successful hospital. And as of today, we are near or at capacity. We're looking at over 60,000 annualized visits through our ED, demonstrating that we've met the mission and milestone of serving our community. Our venture capitalists was the County of Los Angeles and the people of Los Angeles County who funded all the pre-open costs. And kind of what I wanted to share is this is a brand new facility. A brand new organization was put together to run this facility and to be the private nonprofit entity. It is in a public-private partnership with Los Angeles County, so we work very closely with our county partners as well as everyone in our community, all the stakeholders, from Healthcare LA IPA and MedPoint MSO and their FQHCs in our community as well as the IPAs in our community. And I want to say it's good to see some friendly faces in the crowd. To give you kind of context and why this is so cool, for a long time since the hospital was closed, a lot of services weren't available, just outpatient ambulatory services. But there is a 42-acre or 40-plus acre campus, which is being revitalized by the 2nd District Supervisor, Mark Ridley Thomas, over a long period of time, over the next 5, 10-plus years. And on this campus, we hope to be a model to provide all the post-acute care follow-up, to work closely with the medical school, work closely with all of our partners on and off campus, including mental health. Right now, there's urgent care mental health, there's inpatient, outpatient mental health, as well as all the health services as well. And we're the building in the middle. And real quickly, if you ask me what was the coolest thing, and I know I'm at a HIMSS conference with technology vendors and CIIOs and HIT experts in the room, but the number one thing that I think we did from even a technology perspective that was the most innovative in the hospital was culture. Culture is the number one driver at our hospital, how we provide service, how we work with our patients, how we work with our staff that supports those patients. So high quality, high touch, high tech care is our motto, and those value statements I'm always very proud to share. We spent a lot of time early on working on our culture. And just to wrap up, for those of you that may not be completely familiar, this is the structure of how we interface with the county. The county and the UC system helped relaunch this brand new entity and facility in South Los Angeles. And our relationship with the county is very close, but we are independent. We are responsible for the top line and bottom line. We have our own foundation that actually helped raise almost $12 million before we opened. And finally, there's some more stats. We're a 131-bed hospital. I want to get to the app part. When we designed the hospital, we had an opportunity to do things completely from scratch. And one of the things we focused on 2+ years ago in the design phase was we wanted mobile and mobile app technology for both staff, for patient care, as well as for patient engagement. And what you're looking at is these iPhones, and we actually have Androids as well. Every staff person, every nurse, every doctor, EVS, security, they all have an iPhone to coordinate their care and operations for the hospital. Nurses receive patient alerts. Doctors also receive patient alerts and can access patient information directly. And of course, we wanted to do an engagement piece with the patients. So right now, we're about to release our app for the patients where, as we do our discharge planning or transition planning, as I like to call it, we work with them to download an app on their phone. And yes, everyone who comes to our hospital, almost 95% plus, has a phone, a smartphone. As part of our discharge planning, we download the app. The app will alert them for their follow-up meds, for their appointments. Obviously, we can communicate with them directly as a group and an individual. And that's one of the most exciting things we're doing as an engagement piece to make sure that we do that warm handoff and follow-up and take that responsibility as a community healthcare organization, making sure those patients, A, don't unnecessarily come back to the ED, but that they get the right care at the right time in their community. And that's all I have to say, but I wanted to leave this up. If you guys look at a recent TA technology update, if you haven't done it, or if you're just thinking about it, this survey reveals a real need by people like us, consumers of healthcare, that we would like to get our results. We would like to interface with our doc off our mobile phone. So increasingly, mobile apps are going to become ubiquitous like web applications. And I'll pause there.
It's great to be back to Southern California and back to Southern California HIMSS. I've been gone for 8 years, and I'm happy to be back. I'm happy to see my kids and grandkids every day instead of on holidays. So I'm real happy to be back here. I'll try to not say y'all too much because I just moved back from New Orleans. But anyways, is there a clicker for this or like a page down? There it is. I think that's it. Well, let me tell you a little bit about Hoag, but I'm going to tell you a little bit about Auctioneer too in a minute because we did a lot of innovation there that was, I think, worth mentioning. But Hoag is a nonprofit regional care system. It's a small system in Orange County. We have a hospital in Irvine. We have our flagship hospital in Newport Beach. And then we also have a small orthopedics institute in Irvine as well. And we have urgent care centers and health centers around Orange County as well. We have a network of 1,500 physicians and about 5,000 employees. You can see we have a huge volunteer group. You can't walk through the hospital without somebody actually approaching you to see if they can help you. And then you'll see employees literally walking people and showing people where to go because it's a pretty vast campus. So it's a real amazing place. You know what's really amazing is there's a big foundation there, and there's a lot of philanthropy, and it's Newport Beach is it's kind of ritzy down there, don't you think? The mega yachts and all that, but really we do a lot of community outreach into Costa Mesa and Santa Ana, and we have a tremendous amount of programs to help the community. And it's just a wonderful place to work. We're fiercely committed to exploring and to do innovation, and we have world-renowned physicians, and it's just a tremendous place to work. And the IT staff there, a few of them are here, and I have to tell you, the IT staff there is just amazing, and it's great coming back to Orange County. There's actually people there that I've known for 15 and 20 years, and it's great to reconnect with some of them and just see all these people work and how they work together and how they work so hard, and it's amazing. But let me find the next slide. So I want to talk a little bit about improving patient engagement and mobile apps, but first talk to you a little bit about Auctioner. So I spent a couple years down in New Orleans, and we literally doubled the size of Auctioner. And we were having IT press releases every month because of the amount of innovation that we were doing. So I thought I would share a little bit with you. We were doing so much with Apple. Apple came down about 6 months ago and shot a movie. And Apple spent $1 million shooting a movie at our flagship hospital in New Orleans because we're doing so much with the Apple products, with the physicians. For example, we were the first to connect the iPhone and Health Kit to an EMR. And we were the first ones to connect the Apple Watch to an EMR. And Auctioner is an Epic shop. And it's just amazing. We were, I'll just brag a little bit. We were first in the STARS program with Epic, and that means it was the best implemented Epic shop in the world. We were 88% out of 100, and I think the next nearest competitor was a hospital in Los Angeles. I won't say which one, and they were like 25 points behind us. But anyway, so it was great. I'll just brag a little bit. But it was great working in such an innovative area there. We literally doubled in size in the last 2 years, and that kind of growth was amazing. To give you a sense, in 2015, we hit our annual revenue target in April. Now, whoever does that, that's growth that is so fast. And it was really because we were rolling out our EMR to community partners and community hospitals and partnering with them and growing the organization and acquiring hospitals. It was a lot of fun. But what we were doing is, the big thing, I wanted to tell you about the O-bar. So our primary care docs would literally write scripts for the patient to go to the O-bar. And the O-bar is like an Apple Genius bar. And you go to the O-bar and you tell the analyst at the O-bar, my doctor wrote me this script. I'm supposed to load this app on my phone, on my smartphone, and start using it. And they had over 300 apps. They also sold wearables, not just Fitbits, but they literally sold blood pressure cuffs and Whiting scales, and all of those integrated with our EMR. They integrated with our case management, our care managers. It integrated with the EMR, and we had set a lot of values so that if any of these patients are having issues, we literally keep them from readmissions, and we get them in to see their doctor. So it was really, truly mobile health at home, and it was a lot of fun building out the O-bar and building out the disease management and population management programs to connect those patients. And again, being first to integrate Health Kit with an EMR was a lot of fun. I mean, you'd have hypertension patients with an Apple Watch, and it would literally vibrate and tell the patient, hey, have you taken your meds today? Have you checked your BP today? We haven't seen your BP come in, so and we even developed an app where it would tell the physicians, well, I'm due in exam room 4, and my patient is waiting. So we even built apps for the physicians as well. So we were very, very innovative in Auctioner. It was a lot of fun. We did a lot of work with the portal. We got up to almost, I think, 6% of our scheduling was through the portal. So that's pretty good, because we did that in a year. We went from like 1.5% to 6% just by doing a campaign in primary care. And then we did other things. We integrated with Health Grades. So if somebody's looking for a doc on Health Grades, you could literally schedule an appointment with one of our docs health grade actually integrated with our instance of Epic. So that's pretty creative too. And that's a way to grow the business. You actually grow by new patients that way. So, so that was some of the old auctioneer stuff, but I thought I would tell you a little bit about Hoag because that's my new home. And we're, you know, we're growing, and we have some alliances that we need to work on and do some integration. But we use Allscripts, and Follow My Health is the portal. But you know what's really exciting is you know, we partner with St. Joseph, and St. Joseph is building a pretty creative and a pretty advanced portal. It's a mobile portal, and it's built on the Heart Wellness app. And St. Joseph is literally building an extremely comprehensive app for complete nutrition, home health, exercise, as well as integrating your EMR into the app. So it's going to be state of the art, and I think it's coming out of test right now, and it's certified. And this is going to be a pretty exciting thing that's coming out of St. Joseph. And we can't wait to see it in action and get our patients on it as well, because we're part of the St. Joseph Alliance. So another thing we've done is we've also rebuilt our websites to be mobile friendly. And now you can do just about anything on our websites from a phone and not be on a desktop. So that's it. I think that is my last slide. All right.
Good, thank you for that overview.
All right, hello everyone. Chris Nicholson again with mPulse Mobile. mPulse Mobile is a mobile experience management company. What the heck is that, right? So what we do is really help companies go faster in the mobile space. We work with companies to develop mobile capabilities and accelerate those mobile roadmaps, and I'll get into a little bit of detail here as well. Similar to you, Patrick, a traveler from the Midwest, actually grew up in Louisville, Kentucky, so I say y'all all the time, and so that's pretty normal. So I moved actually to California and live up in Westlake Village. I moved here about 1.5 years ago, and I truly get text messages from my wife on a weekly basis that says I'm never leaving California. And so, you know, we are paying the sunshine tax, you know, to be here. So obviously it's half the house for twice the money, but, you know, we put up with it for the weather. So let me tell you a little bit about mPulse and really what we do. You know, we focus again in the health plan space with providers, you know, pharma companies, durable medical, med devices companies, supporting some of the biggest names in healthcare today, such as Medtronic, Kaiser Permanente, Delta Dental, and Mayo Clinic, et cetera. And so we work with these companies to develop a mobile-first strategy and building capabilities in several of the quadrants that you see here on the circle. So looking at things such as medication adherence, preventative service, measures, HEDIS and GAPS, you know, closure messaging, working with them on things like appointment reminders, notifications, even simple things like on Go Green or e-adoption programs to save millions of dollars for those particular partners. And so where we get excited and where we have fun is working with a partner to help understand really what their business needs are and determine where we can leverage mobile and a mobile-first strategy to actually achieve that. I think that Kara mentioned some of the statistics. There are over 165,000 healthcare-related apps in the marketplace today. Of those, 50 apps actually get 50% of the downloads. So there's a lot of good, a lot of bad, and a lot of unused apps that are out in the marketplace. And I think today what would be great is for us to talk about some of the best practices, some of the challenges with deploying apps, some of the things that actually are getting great utilization, and how we can help fuel those as well. The services that we support include text messaging, email notifications, in-app messaging, and even secure messaging, which is really critical as we deploy a HIPAA-compliant messaging platform. So if you are leveraging things such as PHI and those notifications for claim status or, again, preventative service alerts, you really want to be secure with those particular communications. And there's some creative and some very innovative but secure ways to do that in the marketplace today, and so we want to make sure we're sharing those with you as well. The last thing I want to talk about is a couple of the channels. Text messaging, again, one of the most ubiquitous, but one of the biggest drivers to actually push people into those apps that you may have created or deployed today. We'll talk about some of the statistics there, but about 97% of all text messages are read within the first 3 minutes. People look at their cell phones 175 to 180 times per day. So just in the time that we're having this, you know, 35 to 45-minute presentation, you guys have looked at your phones probably 9 times already, right? So, not during the part when I'm talking there, right? And so, it's really important, that we take advantage of that 8 seconds of time that we have when consumers will get that glance, they'll look, they'll connect with their device, and then they'll, again, take action. And that's what it's all about, is getting to action and getting to outcomes in this healthcare ecosystem. Push notifications are extremely valuable as well. Push notifications are leveraged when you have an app and you're leveraging that particular channel to get people to come back into the app and to engage. Leveraging push notifications increases app utilization by 300 to 500%, depending on how they're leveraged and how they're deployed. So again, one of the most meaningful ways to get people to use the tools that you've invested millions of dollars to create by leveraging the right message at the right time and doing it in a very contextual and a very personalized way. The last thing is that, we want to ensure that the messaging, the types of things that we're driving are really device agnostic, so you get the broadest range of deployment, the broadest range of engagement from those consumers. One of the services that we provide a lot of providers, hospital systems, health plans in the U.S. is actually what we call, a device query, which allows us, before you even start to deploy, to determine what your mobile population looks like. So we can help identify from the phone numbers that you have who actually has a mobile device. First, is it a mobile number or a landline number? Is that number, excuse me, on a particular carrier? Is it Sprint, Verizon, AT&T, et cetera? What type of device do they have? Is it an Android or iOS? Because maybe you've only built an iOS app and not the Android app yet, and so you want to make sure you're deploying to people that can leverage those services. And we can even tell you what color the phone is, and we'll get into some other things on security of wonderful things that we can find out. And so I know all the people that have those gold iPhones that are a little bit vain out there. So, anyway, I'll turn it over to next panelist, and we'll take it from there. So.
I am born, raised, educated, schooled, everything in LA, so I don't have to say I've come back home, but do enjoy Southern California. I'm going to deviate just a little bit and talk a little about NantHealth and actually push our app to a specific disease. For those of you that are not familiar with NantHealth, we are part of an ecosystem of the company NantWorks, owned primarily by Dr. Patrick Soon-Shiong. We are part of a family that includes NantHealth, NantMobile, NantOmics, NantQuest, which just went public probably about 6 months ago. And through this transformational journey that Dr. Soon-Shiong has, is the challenge to him that we can make headway in cancer. Some of the things that I'll talk about today will be directly related to cancer. That is our mission. We do have lots of solutions and technology, lots of mobile apps around patient portals. CIIO by ID is a nutritional app, voice activated, a little bit different than some of the apps that you see in the App Store now. Genomic browser, you can actually see the reports from your gene sequencing on your mobile device. But I'd like to concentrate on Cancer Connect, which is something that is now in alpha testing and due to be released at the end of March. About 3 weeks ago, Dr. Soon-Shiong announced a great program called Moonshot 2020. And for those of you that listened to Obama's State of the Union, he mentioned Moonshot in relation to the journey to doing some exciting things in cancer. As part of the Moonshot 2020, our goal is to sequence about 100,000 patients, cancer patients, and identifying in the 100,000 group about 20,000 patients that will have specific tumor types to specific tumors, and then put them into a trial grouping of about 20,000 of the 100,000, and to combine immunotherapies and with the cooperation of pharma working together. And we were happy to announce that we have our first big payer. This is really exciting. That's going to pay for genomic sequencing. IBC, based out of Philadelphia, represents some of the blues, is going to be covering the genomic testing. So Cancer Connect is an app that will be available in the App Store probably end of March. It's in its alpha testing now, and you can access it actually through your iPad, Cancer Connect by ID. And it is the ability to be able to get personalized information for the patient. And in a few minutes, I'll show you some screenshots of what that looks like. But it's the ability of the patient to be able to have one app that can actually give them information related to their disease without having to Google through millions and millions of documents on the internet. Through an app that we have based for our providers, it's called Evity in our Philadelphia office, we can identify if the tumor and filter it down so that a patient can actually, or the provider can actually find a evidence-based treatment plan and a clinical trial and look at its efficacy and its cost and make good decisions about the care of the patient. And I'd like to read some statistics here. 1 in 2 men and 1 in 3 million, 1 in 2 men and 1 in 3 women will be diagnosed with cancer. 1.6 million new cases of cancer in the U.S. Each year. There are 1,600 deaths by cancer each day, and the annual expenditure on cancer care is about $88.7 billion. This is what caught our eye. Cancer drugs are only effective for about 25% of patients. So imagine having a tool that can actually identify an evidence-based protocol or a clinical trial and give you evidence-based information about how to treat your cancer. So the app for this is going to be available to consumer. And if I can just go on to the next page here, I'll show you how this will work. The 4 groups of individuals that will have access to it is the guardian of their information, which is the patient himself or herself, will be the significant other, usually the spouse or the significant other, which is the caregiver, your group of immediate family, and then your support. So at each level, the patient, after entering the information into the app, will be able to share information through this app at varying levels of information how they're doing with their cancer treatment. The patient can access, by putting information about their cancer, information, once again, about evidence-based treatments or clinical trials, and bring questions to their oncologist. This allows for the patient to actually enter questions into their app so they don't forget about the questions they want to ask to the oncologist and actually tape the oncology visit. So they'll have this in their app for them to remember by. So the value proposition is to be able to educate patients on their disease, personalized medicine treatments that could be targeted for them. Second is to be able to allow the patient to be able to look for information and have that information available on their first, second, or third visit. And then third, to be able to keep their family, their significant other, or their close family support friends in helping them through their cancer journey. Allows for messaging within the family and allows for them to be able to send messages back and forth or emails back and forth to their oncologist. So that's just kind of a little bit of one of the apps that we're working on, and I'll take questions later, yeah.
But this whole world of apps on phones is a little bit different. So I'd like to ask the panel, Chris mentioned it too, and maybe we'll start with Patrick. Patrick, what do you consider some best practices for implementing patient mobile apps?
You know, when we were doing it at Auctioner, we thought we thought the OBAR was really the best practice in getting the physicians involved with the patient with their mobile apps. I mean, obviously, there's literally thousands of them out there, right? Isn't that what you said? There's
165,000.
165,000 apps out there, so how do you go and pick one? Well, you know, you need to, physicians need to be trained on what works and what doesn't, and what integrates and what doesn't. And if you can get the physician and the patient together on app selection, then I think you're really going in the right direction. So that was our direction, Kara.
Great, good. Chris, do you have anything to add about best practices for app implementation?
Absolutely, and I love the approach too, which is, you know, the genius bar, because people do need guidance really to sort through all of the choices, you know, all the potential confusion which is there, and you want them to really make sure they're getting the best, you know, content and the best solutions, because, you know, where is that content coming from? If it's giving them information around, you know, diabetes management, you know, maybe it's the right diet plan. Are they really validated sources of content? And so to have clinicians and caregivers really work with them to partner, I think is a great best practice. A few other things that I probably would add in the design phase, I think typically we sort of race to mobilizing a web experience, and we start with the website and we say, how do we get that to a mobile device, right? And so, you know, there's been a lot of models that say we're going to port all those capabilities and all those rich features in a website and put it in an app. And those typically don't work all that well. It's really important to figure out what are those one or two key features, which sounds a little bit contrary to, you know, the approach that we would like to take. You know, but is it about, you know, finding their way around a particular facility? You know, maybe that's, you know, its own isolated app. Maybe it's around, you know, one chronic condition, around cancer treatment, or around diabetes management. Those things that are very specific are the ones that actually drive the highest adoption. And it's really important that in the design, as we think about that, you know, at the beginning, is bringing the patients into the design process for the application so that they actually are really informing what features are really most relevant, which ones they want to leverage while they're on the go, not necessarily which ones may be most important to the administration or facilities within those departments to sort of, you know, get in that app ecosystem. And we've really seen great success where people have pulled, you know, 10 or 20 patients. It doesn't require a lot, but into work groups and into user sessions to really get feedback and help them accelerate. And I'll underline that and say that's not sort of a one and done. You need to continue to do that on a regular basis and see how patients are evolving, whether their capabilities are being leveraged as well. The second thing is, you know, less is more, and so that was really the focus again, you know, not trying to port all those capabilities over. And then the third is really thinking about, you know, it doesn't end at the app, right? So once you've deployed and you're in, you know, the Apple Store, et cetera, now you really need to think about that, you know, multi-channel communication strategy to get people to continue to leverage, you know, those particular services that you've built. And so it may be SMS, it may be email, it may be, you know, the OBAR that's there. All of those different things that work together in concert, you know, are actually starting to get consumers to remember and to start to leverage those particular capabilities because, again, there are so many distractions in the market.
Great, good. You know, I was thinking too, and when we implement normal apps, a lot of investment, often we're asked for what is the ROI on the software we're implementing. Well, in the app world, sometimes cost is irrelevant, right? We can get free apps or penny apps or subscription-based, but a lot smaller investment. But it's still important to track the outcomes because they're representative of our organization. And I'd like to ask Eleanor, given that you come from a background of a CIIO, I'm sure you're very concerned about measuring outcomes and any type of tool you put in front of your patient and clinical population. How will we measure outcomes with apps?
Well, that's a toughie, especially I've worked as a chief operating officer for many, many years, and it's probably the first thing I ask my directors when they want to come and buy anything, not just apps. I think in our world, especially in my healthcare technology world, we're looking at the RIs and outcomes, especially with the cancer patients, as if we find, for example, a cancer that's been treated incorrectly. That's a win, and there's no ROI on that. I can give you several examples of how we've tested using sequencing where the treatment was targeted because it was a breast cancer or because it was a liver cancer. And there are specific drugs that are very specific to treating those type of cancers. And then when you use analytics, which is what the sequencing will do, it'll show you down to 20,000 genes what the treatment plan is supposed to be. You can find out that you actually have been using the wrong drugs. Sequencing is on its uphill, though. It's going to be interesting to see now that one of the big payers has decided to pay for it. We'll be able to measure those outcomes truly in the number of cancers that are that go into remission or the number of cases that actually have a change in their direction of treatment.
Saj, just to piggyback a bit on that, you shared with us that you're creating an innovation center, and sometimes when you balance ROI and traditional implementation and methodologies and approaches with innovation, there's different risks there. And so sometimes we take the risk of innovation and we don't care about the outcome in the beginning. Have you given any thought to in the innovation center and how app development will come out of that and what role it will play?
Yeah, we had as I mentioned earlier, we had a unique opportunity to build everything from the ground up. So we actually looked at our culture and the culture of innovation from the very beginning. And as it pertains to app development, we knew that that the world was headed towards mobile applications. And obviously, for us, we had to assess whether the community was ready, and that actually turned out to be more than simply surprising. A lot of people challenged that in South LA, how many people would have phones, how many people would have smartphones and are using apps. Well, in our population, where it's 76% now Latino Hispanic, where nearly everybody in our area has a smartphone, has an app, we took that into our design. And the ROI, I mean, for us, the way we approached the design was what would benefit the patient and the hospital equitably, meaning what does the patient require. So we didn't really focus on health apps at the beginning, or to say blanket, let's find an app that would even talk to, from a marketing perspective, to reach out to the community. We said, well, we know patients are going to come to our hospital. We know we need to communicate with them about their discharge instructions, how to get their meds, and how to get their follow-up appointments. So we really focused in on some key areas that would be of business value to us and our community partners that share care responsibilities. And how we also implemented was that we didn't just design the app and put it out the first day the hospital opened. Excuse me. We actually did all the main app development and put out care phones to all the nurses and docs, had them use it as part of the patient care. And we evaluated for the first 6 months, we've been open, how the patients perceive that. In fact, the anecdotes I can tell you is that the patients started to recognize that when nurses would text the doc about a certain patient care issue while they were in the patient room, the ding would come back, and the patients would be like, oh, the doctor just replied back to you, and they're like, yeah, you're right, and they became more familiar. Now we're using these same nurses to do the implementation on the day of discharge or the day before, saying, look, we need to have you access your portal, here's how you do it, here it is on your app, and by the way, we'll send you a reminder. Are you okay with that? We want to make sure you pick up your meds. You have enough meds for the next few days, but we want you to pick up these other meds and make sure you have your follow-up appointment. So our innovation strategy is we're thinking visionary. We're also trying to be very practical, and for us that's very important, and that's how we started.
Great, good, thanhanks for sharing.
Hey, Kara, I've got a couple comments on
Please, go
innovation
ahead.
strategy real quick. You know what one thing we did at Auctioner is we had a couple quick wins, so we built a little credibility. And then we sort of threw ROI out the window, and we said, if we can invest in innovation and hit one home run out of 10 tries, then that's a win. So we threw away ROI, and we actually enabled the innovation lab to be innovative. Everybody else in the health system, they had to, they weren't allowed to download software. Well, the Innovation Lab, we gave them their own connection to the internet. And everywhere else in the health system, if you wanted to buy any technology, you had to get a purchase order, you had to get CIIO review. The Innovation Lab, they can buy whatever they want, and they can innovate and they can pioneer. and they can try and they can fail and they can fail fast and they can fail over and over, and forget the ROI. Let them innovate so that they can build, and that's how we were able to be the first to get the Apple Health Kit to talk to an EMR or the iWatch. And if you're focused on ROI, on innovation, then you're not going to be a pioneer.
Yeah.
So that was just the comment I wanted to add.
And actually, let me add to that. So, you heard that we would like to launch an innovation hub, a center on campus. And actually, what we're doing, similar to what Patrick mentioned, is we're actually opening up what we call an innovation garage and letting them have access to whatever they need to kind of break and fail. So, yeah, you can't do ROI on that one. So that is our initial approach. And I recommend, there's actually an article that came out on this concept of setting up your own innovation garage in a healthcare setting, which I thought was very, though we were doing it already, but it's very poignant.
Great, good. So, innovation's great, and we all have apps on our phone, but sometimes they just sit there, right? And we don't always use the ones that we download. So adoption is a really important factor. Now, adoption with CPOE has kind of not come to its day, and we've had helpful things like meaningful use. But if we invest all this money and we have all these great ideas for apps, how do we get adoption? How do we get that stickiness? Chris shared with a statistic, I think 50% of all the apps are the only ones being used. So maybe I'll put it to the entire panel. How do we manage adoption? How do we get the patients or consumers to use these apps that we're deploying? Maybe not big investments, but still time, effort, and we have goals and objectives in their deployment. Chris, I'll start with you at the end.
Sure. And I hit on a couple of these points earlier, but I think it is very critical to think about a broad communication strategy that does employ feet on the street. It's the nurses, it's the person that discharged who's working with them to talk about what services they need to have as they're walking out the door. That is tremendously important and very meaningful to patients as they start to embark on that journey outside of the doors of the facility. We leverage multiple strategies from SMS, push notifications I mentioned earlier, which are very subtle ways to actually bring members in. And so we work with partners to actually follow through and actually look at the data of who is not engaging, when was the last time they've logged onto the portal, when was the last time they engaged in the app, and so whether we're giving medication adherence reminders, notifications. If we see people fall off in utilization, one channel for an app, for example, we'll use another channel to really nudge them back in and see if we can actually get them re-engaged to leverage those particular tools. We've seen that be tremendously effective through medication adherence, order refill management with companies like Medtronic, and even just closing missed appointments with companies like Kaiser Permanente and improving that by roughly 7%. And I think you guys can, the stats vary based on facility, but missed appointments worth between $200 and $1,000 depending on which condition and which facility. So there's a lot of things that are sort of low-hanging fruit or maybe not quite as attractive or as sexy, but they're very meaningful to the bottom line of providers and organizations to really make change. You guys tackled a lot of those operationally from a consumer experience perspective to do that. And so I think it's really critical that you develop a multi-channel engagement strategy around that app that leverages all these different touch points of where you can engage consumers. And most importantly, you want to do that in tools that they're already using and they're already engaging. So the app is, again, something that's a little bit foreign. It's sort of off. It's sort of 8 layers deep. The average consumer has over 75 apps on their device by itself. So there's 75 choices of things that they can be distracted with. So they're going to get to Angry Birds before they get to your particular app that's in the market, right? So those push notifications that sort of nudge them to the right place and bring them into the fold. You guys have done it many, many times. You do it so subtly and so subconsciously that you don't really even realize that you're being pulled into those things. And so really making sure that you're thinking through that engagement strategy and then testing different approaches with consumers to really see what resonates. And it does vary tremendously based on what the use case is. The way that you may nudge somebody in for a clinical trial and a program to continue to log results versus the way that you're reminding someone about a medication they need to take are very different, and the tools that you're leveraging as well. So again, a multi-channel engagement strategy is critical to really get value out of the application you developed.
Patrick, do you have any other tips about how to get our patients and consumers to use those apps?
One idea we were kicking around is having patients do their scheduling online give them a $5 reduction on their copay. You know, and you can save $5 in labor by having the patient do his own scheduling. So that's one thing we were kicking around. But you know, so basically what that means is incent the patients to use the apps. And if you can incent them, you know, it's interesting. I'm working with a trainer right now, and I'm sending him my results of things that I'm doing from nutrition to training. And you know, and the program I'm on with this guy is, if I send everything in timely, I get a reduction on my training bill. So it's about being incented. So if you can incent the consumers or incent the patients, it's amazing how the adoption gets increased. So I find incenting as a great motivator.
Saj or Eleanor, anything to add? Saj, you shared that you were including in the workflow for discharge, so that wouldn't involve the patient. Anything else? Or Eleanor, anything about adoption?
Well, I was kind of reminded of a story that my granddaughter told me the other day, and she was wearing what I thought was a Fitbit, but it was an activity tracker of some sort. And you know, she got up from the dinner table and she goes, "I've got to go do 1,500 more steps." And I said, "Why?" And she goes, "Well," she goes, "you know, this bracelet," she said, she goes, "if I do 10,000 steps a day," she goes, and she's 9 years old. She goes, "if I do 1,500 more steps," she said, "you know, a bag of food goes to a hungry child in Africa." Have you heard of this this program? It is about incentivizing. It's captured on an app. She looks at it. She's a basketball player, so she never usually has problem reaching 10,000 steps, but she's linked it to something, and it's meaningful to her. So it's something, you know, there is something about incentivizing. I'm going to think about it for a second here. I do have the name of it. It's you can buy it through Target. And you guys are going to kill me, but it is through one of those big agencies that sends food. God, I'm at a loss here, but I'll think of it in a minute. I told that story around Christmas, and 5 people that were around the dinner table with me bought the app, bought it right at the dinner table because I talked about it. So that just shows you what the influence is.
And I think that's an excellent point. We are moving to environment where opinions are driving our behavior and decisions. How often do now, before we go to a restaurant, we visit Yelp and we want to check scores and ratings and feedback. So the way that we make decisions as consumers are being changed by technology, and very perfect example here of just the word of mouth. Meaning a cause created people towards that app and then becoming physically fit. So wonderful story about adoption. You know, Eleanor, you do make me think, though. I'm getting a little nervous. I'm going to have all my genetic information and my cancer information on an app. Should I be worried as a consumer? What about security?
Yes,
Well,
Tell us.
Well, security is a big issue. You know, we're working with a big self-insured employer, over 200,000 employees, and it's got a denominator of about 400,000 people. We're going to be pushing out a health notebook, and yeah, it is an issue. You have to go through the hoops. You have to make sure that you're testing and make sure that we're probably going to go through 3 months of making sure that all of our things are secure and confidential. So that being said, I think there is a place for mobile apps, and it's not going to go away. So
Great. Secure. Oh, we have a question. Let's pause.
No, I don't have a question. I looked it up. It's called the UNICEF Kid Power Band.
Oh, UNICEF Kid Power Band.
that's what it is, UNICEF.
Yeah. Okay.
Thank you for sharing that. But you don't have a question. Okay.
That was Siri. In the back.
Thank you for looking that up.
Yes, Siri helped us find that. All right, great. Security, we were just talking about security, and I think just as with all technology, once we start to get mobile apps and we're on phones and World Wide Web, things can get kind of dark out there. and there's hidden things with app usage, kind of a dark side that we haven't talked about yet as a panel. And I think, if we're doing all this effort to work towards adoption, how do we deal with the pushback? And how do we have people use apps safely? And what are some of those things out there that we should be watching out for? I'll start at the far end with Chris.
Sure. I'll take it a couple different ways. So there are some dark sides, to the app space. There are a lot of, what I call look-alike, apps in the market. Again, 165,000 apps that are out there, and that stat is at about 50. It wasn't 50%. It's 50 apps actually have 50% of the downloads. So there's a lot again that are really unused. But there's a lot of these look-alike type apps that are there that'll get people to download, the app. They put it on their phone. And how many of you just click OK, OK, OK when you're downloading and you don't read all those little agreements of what you're signing up for, right? Who reads all those? Raise your hand if you've read any one of them. Okay, nobody, right? So one person in the back has read those. The one guy, and there's always that guy, right? So you really do have to be careful, and I think this is one thing just as a parent, I think for us to really educate our children on as well. But for us and even to educate our patients is really critical as we spend time in those arenas because, consumers are very trusting of things that they see online, things that they see, in the media, et cetera. And typically you're giving access to your contact list, you're giving access to your photos, you're giving access to all of the email addresses that you have and contacts. You're actually even sometimes enabling the microphone or the camera on your device so that when you're using that device, they can see you using that device. And so I think people need to really pay attention to what they're doing and not be so trusting necessarily. Now, does that mean as an innovator and entrepreneur that I say we should slow down on app engagement, utilization, and what we're driving for? Absolutely not. But again, we need to, put caution out there and be very responsible and to teach that responsibility to these new users that are leveraging the technology.
Any other questions, concerns, pushbacks? Anybody had any experience? Yeah, and I'd like to add, I really commend Patrick for what they did with the O-Bar because I think our patients are out there and they want to download an app, but they don't know where do I begin? If I search and there's 165,000 apps, where do I start? And our patients do look at our clinicians for guidance as if they're prescriptions. So as providers with organizations, more that you can vet that and guide them to maybe approved apps could possibly help some of our adoption. So great practice there. Okay, let's talk a little bit about the groupings of apps that are out there. So when you look at the App Store, it tends that there seems to be three groups. There's disease management type apps, the kinds of things that Eleanor's team is working on, focusing on cancer. Then we have a whole category of wellness apps, which are all of our MyFitnessPal and people with Fitbit wristbands. And then there's some administrative apps. So we heard some of our panelists talk about bill pay and scheduling. I'm curious, what have you seen? If we were going to start with one of those areas and we're a new hospital kicking off this mobility initiative, where should we start? Where's the biggest win? Where do consumers and patients like the best? What should we focus on? Where do we start? Saj, I can start with you.
I was writing my answer down.
Oh.
Like any one of us in the room here, there's a few apps that we use, right? There's a few key apps. For those of us in business, it's unfortunately the email app and our calendar app. But there's a few key apps that are important to us as individuals. I have the MyFitnessPal app, and I use it because the food provider at our cafeteria does all MyFitnessPal codes, so you can just scan and go. So I think to answer your question, in the healthcare space, I think it's very much akin to how it was when the internet first launched. In fact, when anything first launches technology-wise, medicine is the first one to jump on and say we could solve this problem, that problem. And actually having launched way back in the day a couple of web-based applications when MDON and WebMD, when MDON took over WebMD, and trying to see what self-insured company employers would use and what we would use as consumers, I think it's very challenging. There isn't any one app or any one category that I feel really has traction, but I think what's coming up very quickly is really smart apps like off of your Siri or your Android. I forgot what the Android voice is called, but I use her or him. And those apps where especially if you're a parent and you're like, hey, my child has a fever of this and these spots, what do you think is wrong? So I think where the need is, like for parents who want a quick answer to an ailment for their child, or for those patients, those folks that have chronic conditions that want to be able to manage those conditions and ask in real time decision support questions. I think those apps will drive it. We're not there yet, but I think as Siri gets smarter, I think you have Watson coming up, and there's actually a few other companies that are challenging what Watson can do. But if you can imagine Watson on an app and say, hey, I'm experiencing this headache, I have this cough, I have this rash, let me take a picture of it. What do you think it is? And then have all that information then sent to your primary care doc, including what it could be, and have the app tell you what to do now. I think we're still waiting for the quote unquote the killer app, but I'm kind of describing a killer app I would use. So we don't have one yet in healthcare, is my opinion.
You know, I think St. Joseph has a pretty good strategy on trying to integrate healthcare, fitness, and nutrition in their strategy. So I think they have a killer app, and I think everybody's going to be pretty interested in seeing it later this year when it debuts. But I'm really excited to wait and see on that.
I saw Larry out there. Is he out there?
You know, I
You
think
guys have a name
it's
for the
more. It's called My Heart.
My heart?
Or Heart. Actually, it's heart.com, HART.com.
Oh.
But you know, I think that's going to be a killer app. But of course, you have to be affiliated to St. Joe to use it. You know, but I'm just saying. But you know, I think to answer your question, Kara, I think it's health, fitness, and nutrition is how I would break them down, and that's how I look at it. I mean, I have my health apps, and I have my fitness apps, and I have my nutrition apps, and you know, they are silos, and you know, when I see what St. Joe is doing, they're integrating the three, and that I think is really cool.
So later this year, outside of the cancer world, we're this big insured that we're self-employed insured that we're going to be working with. We're going to be combining all those into a wellness program, and I think that's on the front of our killer app. It's looking at they have about 50% of their employees that are either pre-hypertension stage 1 or stage 2, and we're going to be utilizing the information through given to us by the employer through an HRA that 85% of their employees actually fill out, that I can identify that great number of people that will be able to access and combine nutrition and fitness, some of the things related to stressors later this year. So stay tuned.
Great. Well, Patrick mentioned a little bit about strategy, so some of us might be saying, where do I start? You know, this is pretty big. First of all, Kara's talking about different categories, and, you know, I have my, I hear that there's vendors that can build apps for me. Then I have my current software vendor relationships who tell me there's a mobile platform of some software that I already own. And then I wonder, maybe I should have an innovation center and I should be building my own. Maybe I should become a development shop. And these are all discussions that need to be had within the organizations. And how are we going to deploy this? Are we just going to go let each one of our groups come to us, our customers, as they have historically with their requests and requirements of a vendor called on me and now I want to buy this mobile app? Or should there be a strategy where organizationally you make a plan? I think Chris used the verbiage mobile first. And I'd just like to ask the panel if they have any comment about planning within organizations and how they should maybe get their arms around it or just let it flow and let people do what they want.
Patrick, do you want to go first based on your experience? Or?
You know, I think you should have a strategy. You know, if you're a health system, you need to have a strategy, and then you need to execute on the strategy. You know, we're using our patient portal and we're making our websites more mobile friendly. I mean, that's our strategy. It's not a long-term strategy, but that's our strategy. And again, you know, we're waiting on on heart from St. Joseph to really be more of the longer-term strategy. So,
But when you're at Ochsner, let me ask, if a clinician came and said, I'd like to have result review on my mobile app, and I have this great product, I'm going to pick on Airstrip. Airstrip is a great cardiac mobile application. Well, do you as an IT professional guide them towards, well, I'm not going to have you use Airstrip because I have a portal? Or, wait a minute, maybe that's something we want to build ourselves. So how are those decisions made at
That's the
Ochsner?
beauty of having an innovation lab, because if you have hundreds or thousands of doctors, they all have a lot of great ideas. You just don't have the capacity to deal with all that demand. So you move it all to your innovation lab and let your innovation lab prioritize their opportunities and work it. That's what I did. That's the way I approached it.
If you're a large system. So I think
But you're a small system, and you're going to be able to do innovation, so
Yeah.
you figured out how to do it.
Well, only because, and I think the answer is it depends on what your organization is positioned and how it's positioned. So if you're a large integrated system, Kaiser has its innovation centers, and a lot of the large ones do Cleveland Clinic. As a standalone community hospital, our big partner is the county, and we have this opportunity on campus and to also leverage our relationship with UCLA and USC, so we can create an innovation garage. But the strategy around doing some of these things was, that you actually asked the right question. Do you build it? Do you buy it? Do you explore it? Do you get the vendor to develop it with you? And for us, we heavily invested with, we're a Cerner shop, we heavily invested with Cerner and decided to go all in with their roadmap that they had for their app development for the inpatient care on the mobile phone. For outside of that, we're too small to develop, but we're using the innovation garage, as it were, to explore what's the best path to go and then leverage all of our partnerships to see if UCLA would come in and share their resources, or maybe St. Joe's and Hoag share their resources. So, we beg, borrow, and steal as a small entity, and that's part of the innovation approach. So you have to kind of assess what will bring the best value to you.
Well, I have a problem. I have philanthropy money, and
I can help with that problem.
It's a big problem because
we really need help.
Because when a donor gives you money, then you have to act on it, and then you want to show good results so that you can get more money, right? It's like a cycle.
We could be a lab partner for you.
So what we're going to do is I actually have a strategy on the table now to build an innovation lab at Hoag, a small one, because we can also leverage St. Joseph's innovation lab. But we want to take that Hoag philanthropy money and literally do all kinds of cool, innovative things across various diseases. So we're building it. We're building it around interoperability and wearables and a few other things. And we're looking at the strategy now.
I'll give you my card.
Okay.
Chris, put you on the spot. You
Sure.
can decline to answer. You mentioned that you do app development and you help such organizations as Mayo. So in kind of the same line of what we were just talking about, why did Mayo work with you and not develop their own app?
And every client we work with knows exactly what their strategy is and exactly what they want to deploy. And there's no prioritization issues, there's no challenges or anything like that. The space we're in, we typically, as we align with partners, to get to strategy, we figure out what we call a crawl, walk, run strategy, right? So nothing, overly strategic in other than breaking apart, what we can do today, versus what we want to do and what's aspirational. We really help work with them on things such as, the prioritization internally, meeting with different business teams, different operators to really understand, those aspects of the business. But then again, pulling in the consumer feedback, and the patient feedback on really what's valuable to them. Because, people will start and stop many, many times over the course of several years in building a capability. They'll launch it to the App Store. They'll watch for those number of downloads. They'll spend $5 or $6 million to download, and 67 people will download that app. It happens all the time. And so, really saying, okay, now how do we back up and say, what are the consumers wanting, them to create first? getting some really good wins with them as well. And so I think, one of the reasons that I feel strongly that our partners like working with us is we really challenge them versus, I think, the sort of yes partners that say, yes, we'll build that, yes, we'll build that, we'll build whatever you want, is we really step back and say, let's really build something that's going to be successful in the market versus just putting something out there and having that be where we put the flag and said, an app is there. So success for us isn't in deployment, success for us is actually in getting engagement.
Great, good, thank you. You talked a little bit about involving the consumer. How do you, and this is to our two providers, Patrick and Saj, how do you involve the patient in selection or feedback? Do either of you, in your experience, have any mechanisms to get the feedback from the patient?
Well, at Auctioneer, we, when we connected patients through our portal and through messaging, we would send surveys out to them and determine what kind of, we'd analyze that feedback to see how we can provide more services. So surveying through the portal messaging was our strategy.
And we're just rolling it out, but we're looking at the opportunity for, we're looking at surveys through text messaging, even though there's an app. We figured we'd get better response because people, even I think we all respond to text messages more habitually than the app push notification. So we're looking at simple survey responses, have you used your app this week? Did you get a notification, et cetera, just to get feedback. But we haven't gotten enough data yet.
Great.
That's great.
Okay, we are going to have about 15 minutes left, and I want to have some time for Q&A. So before I ask the last question of the panel, I want you to start to think about any questions you might have, because we'll be going to that part of the program after. So my last question, I'll address it to each one of the panelists. I think some of them have kind of touched on it, but what do you see the future is? What do you see the future is with patient and apps? And I'll start with, go ahead, Patrick, we'll start with you.
You know what I see? I see patient visits on the phone. Imagine driving the 405 and doing a doctor appointment at the same time.
You mean parked on the 405?
Yeah, right. I was telling somebody earlier, I've been trying for 3 weeks to get my car in the shop, but I've been so busy with meetings, I can't get my car in the shop. Imagine if I was trying to get a doctor's appointment. Well, if I had e-visits on my phone, I could have done an e-visit today while I was doing this wonderful commute this morning on the 405. I could have, I think 10 years from now, you'll be able to do a doctor visit while you're on the 405, while you're on the train. I wouldn't recommend doing it in the shower, but you could probably do an e-visit, from just about anywhere. And imagine all of the connectivity to your phone in the future, such as vitals and so forth. You may even So I think what I'd like to see is more mobile e-visits from the phone, so that you can do it anywhere and maybe anytime. And there's a lot of e-visits on demand, like ZocDoc and things like that. But to be able to do on demand through your medical group anywhere, like a FaceTime visit, I think would be really, really important for very, very busy people like us. Because again, I've been trying to get my car in the shop for a month and I haven't been able to do it. So,
other vision from the panelists on future?
Well, I see us headed towards personalized medicine. I think as the consumer becomes more and more savvy on what should be happening to them as not just patients, but as consumers in general, I think the whole world of personalized medicine is actually the future.
So this is just two things I'll share with you real quickly. One goes to, and I love personalization, and I'll take it just a little step further, is context or contextual messaging. And so if you ever heard the statement, content is king, well, context is really the kingdom, right? And so when you think about delivering messaging, knowing where someone is, knowing what place they are in, knowing maybe the mood that they're in, maybe even not sending a message because we know that they are traveling on the 101 and they're stuck in traffic. So even using the device, data, knowing that phone is in motion, holding a message to the right time when it's most relevant for the consumer is really critical. And so we're seeing really neat, innovative technologies that are starting to leverage these in the app space, and then that creates some amazing data that comes back into the systems that you can use as partners as well. The second major trend that we're seeing is around voice and natural language processing. And so the way that we access, the way that we engage these apps is actually even moving away from touch. Boy, it was really easy to use those iPhones created, with one button, one touch, one swipe, et cetera. And I think you mentioned voice, is becoming so dominant, is that really the evolution in the next 2 to 3 years is that so many of the apps and the way that we interface with them will be through natural language technologies and just speaking freely and conversationally, and those tools actually really adapting and learning our behavior. And so that's really pretty amazing when you think about the potential and how close that is for us.
Okay.
I'm just going to reinforce what Pat, Chris, and Eleanor mentioned, and just add that what Chris is talking about is I live in Redlands, California, and if you don't know anything about Redlands, you can know one thing: the global headquarters of Global Information or Geographic Information Systems, called ESRI or ESRI, is there. And I get to talk to all the ESRI folks because they're hanging out at the Trader Joe's, at the cafe. And there is a great push to having GIS-based information, location-based information. But, Patrick hit it right on the head as someone who launched eConsult, where you can have primary care docs talk to a specialist via just even texting or simple messaging. And we're going soon to live visits. I think that the killer app for me would be a combination of something that does GIS, something where I can use NLP, natural language processing, to get my decision support, and then when I know if something's serious, I can press that button, whatever that button color is, and say I want to talk to my doc, and have an actual reimbursement, plan or a health plan that offers a plan design that says, hey, for those of you of the new millennials or people like us that are too busy to have an office visit, we'll give you a $5 copay or make it free for all your visits. Because if you really think about it, a lot of the times if we are in communication with the doc and the doc is talking to you, 80% of the time they can diagnose you right there on the phone in that interaction. That live visit is very important. So that decision support, self-diagnostic, or live consult, I think is the key. And I'd like to see it in 2 or 3 years. I think it's going to come up sooner. You're going to see telehealth and teleconsults really take off.
Awesome.
Great. Well, just in wrapping up, just to summarize a few of the comments that we heard, takeaways, I think that we all need to think about innovation. We need to be agile and fast to fail. We should definitely set a strategy for mobile and patient engagement and applications. Make sure that it includes a strong multi-channel communication strategy. Don't forget those incentives. Be careful and be safe.